Hi, I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Jalusil Plus. Heartburn affects up to 85% of women and tends to worsen as your pregnancy progresses. Now, there are two main reasons for this. Increased levels of progesterone cause the muscle sphincter or the ring at the entrance of the stomach to relax, allowing stomach acids to travel back up your food pipe, causing heartburn and indigestion. Towards the later stages of pregnancy, as your baby grows, heartburn can also be caused by your baby physically putting pressure on your digestive tract. Well, luckily, Jalusil Plus, with its dual action effect, can see you through this uncomfortable time of your pregnancy. Jalusil forms a barrier over stomach acid to keep it in place while working to neutralize the stomach acid. For more information about Jalusil Plus, visit www.jalusil.co.za. Jane, welcome to my studio.
Thank you, and thank you for inviting me, Margriet.
Yeah, I'm so excited that we get to do this together.
Yeah.
But before we jump in, just tell us a little bit more about yourself.
Okay. I'm Jane Sibidi, passionate midwife. I am.
You are.
Advanced midwife. And I've been in this field for years, more than 30 years. I've worked locally as a midwife, as an operational manager, as a deputy director, and I went overseas, did the same as well, came back 2014, and I joined MomConnect. And when I joined MomConnect then, I thought, is this a demotion? But it wasn't. It was a calling. Wow. Because those moms, I believe, they need support. They need somebody like you, Margriet, just to listen to them and support throughout their pregnancy.
Oh, beautiful. Yeah, so we're going to be talking all about mom support. And that's what we're both really passionate about about that. So, Jane, you're a midwife. I love it. Jane, you joined 10 years ago, right, with MomConnect? Okay, so MomConnect, what is that?
MomConnect is a flagship for National Department of Health, powered and led by Minister Dr. Muzwaledi. He actually saw this concept in India and Pakistan and felt at that side when we were not able to achieve the Millennium Goals, that it can be useful to empower women, pregnant women, and due to high mortality rate, we were obviously, due to research, not going to even manage to get the Millennium Goals. So there were a lot of innovations that were brought into space to make sure that we propel ourselves towards, SDG. So MomConnect was one of the innovative, and by then, 2014, I must say that our antenatal rates, early antenatal rate attendance, the postnatal rate, we were very low. And since then, I'm happy to say that you saw the stats the other day. We've actually gone from 40% to 68. We've gone down, we were above 78, and then due to COVID, we went down to 68 now. But we can do better. We can actually cover the remaining 38%.
Yes, you can cover everyone.
To make it 100%, yes, why not?
Absolutely. So MomConnect was an innovative plan that was seen as a tool to help with better birth outcomes and
reduce
maternal mortality rates. Yeah. And you've got 10 years of experience and you've seen the impact. So because I know, but maybe the listeners don't know, MomConnect is all about connecting moms with good education, right?
Using a cell phone.
Yeah, so explain a little bit how it works. What is MomConnect?
Okay, MomConnect is just a platform where we educate the moms. We encourage them to register as soon as they are pregnant so that they can all get all the support, emotional, psychological, and the messages are in such a way that they are in 11 languages on SMS. Unfortunately, on WhatsApp, they are only in English. But MomConnect has got 3 components. Your FAQ, which is automated once the mom is registered. We've got the help desk, which actually moms can ask questions.
Beautiful.
Regarding pregnancy in 11 official languages, and
Sure.
they'll get the response. And I must tell you that on that help desk, we're getting around 800 to 1,600 questions daily.
Wow.
From the moms. And then we've got the complaints and compliments, where the moms can actually compliment the services that they received. They can also complain. And the minister said, Jane, according to the complaints policy for the department, you're not going to wait for 28 days to actually respond to those questions. Phone the CEO and
Sure.
tell them that there is a long queue so that they can actually act. So I've got those powers to actually phone the CEO and say, and tell them that there's a patient here who's been waiting. Can you imagine the newly delivered moms with those episiotomy, with the mom who's struggling to even latch the baby, waiting for 4 hours, and she's got also other kids at home to support, to make sure that they come back from school and get the food. She's waiting for 8 hours in the clinic. So with MomConnect, they get educated, they get empowered, they get supported. We can also refer them to people like you. We're not actually saying, we are MomConnect, we can do this alone. We want partners.
That is really incredible. So MomConnect serves so many different purposes, and you can do a lot with it. And I love what you say, that feedback that you can also get. It helps you to have the ears on the ground as a National Department of Health. That's beautiful. So, so a mom can register herself. It's on the cell phone, and she can get. She gets regular messages, or how does that
Let me take you through.
work?
Let me take you through that. Once the pregnancy is confirmed, or once the mama hears that she's pregnant, she's advised to go to the clinic. And when she's in the clinic and pregnancy is confirmed, then she gets registered by either a community health care worker, a data capturer, or anybody who's actually having the knowledge about MomConnect. Or she can register herself at home and then go to the clinic, because once she registers herself, we need to know that she is positive, she's pregnant.
Pregnancy, yes.
Yeah. So if she doesn't go to the clinic to register herself, then she gets only 6 messages reminding her that, welcome to MomConnect, you are actually temporarily registered to the platform. However, you need to go to the clinic to confirm the pregnancy.
I see.
Why do you want them to go to the clinic rather than go throughout, their 9 months without the support? Because they might be having complications. They might need management. They might need that psychological support throughout their pregnancy and direction. And also, we've got mental health messages. They might be going through the challenges. So if they are in the clinic, they've got those resources. They can be referred for support throughout pregnancy, and they could be managed, to avert the complication that comes with pregnancy.
That's so smart, so clever. So you give them a teaser, but they only can get more once they've been to the clinic, and therefore showing how important antenatal care is.
Yes. And the messages are actually carried over from pregnancy. They cover your antenatal, your intrapartum, your postpartum. We cover mental health. We cover, it's quite a lot. Baby messages, once they deliver, they can send a word to say that baby, and then we convert them from pregnancy messages to baby messages for 2 years.
Wow, that's a massive resource. Beautiful, and it is for free.
It's for free.
It's
for free.
You just need a phone.
You just need a phone, and then once they are registered, but they have to have data, but
Of course.
they get 0 rated from the Department of Health.
They get?
0 rated.
Okay.
Yeah, it charges them with SMS. It's like one and something, but they get the funding back. It's completely free.
Amazing.
The same with WhatsApp. It's
Yes.
free. Mm.
Yes. So your mission is to let every mom know about this and every midwife or healthcare professional out there to actually get 100% coverage, that everyone can be on the program.
Yes.
Yeah.
And it also supports the midwives as well. Can you imagine?
Yes.
When I was doing training or when I was still practicing as a midwife, you have to educate as well as one of your role.
Yeah.
So you might be inundated with a long queue, women who are actually full and you cannot manage. And as we are aware, we have shortages of staff and you don't even have time to actually do other things, documentation, palpation, and all the other things, and history taking within the 45 minutes that is allocated for one woman. But if this woman has got a cell phone, registered to MomConnect, she's got everything.
Yeah.
She can also go to the browsable content with WhatsApp where she can get like 5 pages or a book informing her about pregnancy, complications, all the normal stuff, all the complicated stuff, and anything that she needs to know.
Beautiful. Gone are the days that we say what I didn't know. Because information is actually our tips. We need to know. And we can empower ourselves.
Absolutely.
Yes. So tell me, Jane, over the 10 years, have you seen, what kind of impact have you seen for our country during this program?
During this program, let me start by saying, like I said, we've got the complement side of the MomConnect, which is from the program itself. When we started with the program, we thought we were going to be inundated with lots and lots of complaints. As we know that our service delivery is suboptimal.
There are challenges out there, let's be honest.
Yeah. So Minister Motsoaledi kept on asking, Jane, you kept on, I do weekly reports regarding the data that comes through registration, complaints, and compliments. So we had lots and lots of compliments from Mom, appreciating the platform. And he was saying, aren't you hiding the complaints? Because I'm expecting huge amounts of complaints coming through the system. What is happening? And he shared, he was actually monitoring as well. He got access and he was monitoring himself to see if we're not actually trying to hide some of the complaints. So he found out that there's lots of compliments. Even when he was going around, he will talk about MomConnect. Moms will be telling him that we appreciate the program because it's empowering them. So in terms of empowerment, we feel that we managed to actually increase the antenatal early registration. We managed to increase the postnatal return from the clinic. Most of the moms, what they do after delivery, they don't honor those 0 to 6 days post-delivery.
Yes.
They just do without, and they still need continuous support, especially to see if the baby is latching, the baby is feeding as she's supposed to be. But they ignore that. So we support them with those messages. So we've seen that the postnatal rate has increased, and also we do various research regarding MomConnect as well. You can go on the desktop just to see. So we've got an impact, 5 years impact, which revealed that the breastfeeding rates increased.
Wow.
And there was exponential increase in family planning usage. So I feel personally, having reached 5 million, we've got an impact. And we can do more.
Yes.
We can do more.
Yes.
And those questions that are coming through the help desk, as I said, we're actually having 800 to 1.6 questions coming through the help desk daily, and over 30,000 questions monthly.
That's a lot.
It means that those people, the pregnant women, are actually hungry. They need to know more, and they need someone to actually empower them.
Yes.
And if we are a team, Margaret, I think we can do more.
Yes.
We can inform those mothers and reduce maternal mortality.
Absolutely. So true. We can do more. So what is your dream for the next 10 years?
To have another 5 million added to the 5 million that I have for the next 10 years. 5 million times 5.
Yes.
Yeah. So I just want to see us actually empowering every pregnant woman, because they are vulnerable.
They're very vulnerable. Absolutely.
They need our support.
Yes. Yeah. And as you said, the healthcare professionals are often overloaded with work and busy. They don't have that individual time. So this is a wonderful tool. Yes, and I'm very excited to collaborate with this initiative, because we have so many resources available, but many of the women that would connect to MomConnect might not know about us, and vice versa. So that is why the collaboration is so key. Hey?
True.
Yes.
And also I think the private, what my vision is to actually embrace the private clinics as well.
Absolutely.
Because sometimes you do think that when you are having a medical aid, fortunately,
you know everything.
You know everything, and the doctor is going to give you all the information.
Opposite is true.
Opposite is true.
Yeah.
So they don't get that information. They go there, doctors come in for. I went through the same as well when I was pregnant.
Really?
Wait for this private doctor, and he's going to do cesarean section. He's going to do whatever. When he comes, he say everything is fine, and then, what is new? Do you have any questions? I go, nothing. You look well, thank you, ma'am. We'll see you next week.
Yes.
So we need such information. If you know, the MNOs have actually shown us that South Africa has got 80% penetration of cell phone. Why not use that?
No, absolutely.
And the moms are actually having WhatsApp for their own social things. Why can't we penetrate the space?
Yeah, that's so good. Yes, that's the good thing of technology. You must use it for the best.
Yeah, true.
Yeah, no, I'm dreaming with you, and because apart from just preventing deaths, no one should die, but even good birth experiences and good parenting, all of that is in a woman's hand.
True.
She has to take ownership of it, and she can empower herself to have a really beautiful journey and an empowered journey. It doesn't matter if she gives birth in the government sector or in the private sector, you need an empowered mom. So I hope this will encourage a lot of moms out there that are listening, and spread the word. Spread the word to anyone.
Let's spread the word. Let's spread the word.
Yeah.
Yeah.
So how can they register?
They can register. The number that we use is *314-3550 when pregnancy is not confirmed as yet.
Okay.
But as soon as they are in the clinic, they use *134*550*2#. And they can also opt out using the number 3134*550*1#. Opting out, of course, we don't want them to opt out because we want them to be informed. However, they can have miscarriages. They can realize that, this is not for me. I can use other means or so. So we're not coercing them as much as we need them. We also, they've got the freedom and the right to actually opt out.
That's
so
good.
Those are the numbers. And they can also go online and check. They'll find us there.
Go search MomConnect. But I will definitely put those numbers in our show notes and make it all very clear that moms can register. Or register your sister or your friend or your colleague or wherever. Register. All pregnant mummies.
All pregnant mummies.
I think I want to fake it that I'm pregnant. I want to check it out again. I know the program, but it's been a few years ago. I want to see what you've done with it.
Okay.
Yes.
All right.
Yeah, very exciting. Amazing work. Keep up the good work.
Thank you.
And I'm happy to collaborate.
Yes. We're looking forward towards that journey.
Absolutely.
It must be for life, Margriet.
We are connected for life.
Yeah, true.
Good. Wonderful. Thank you so much. And thank you for everyone for listening to this very beautiful message of connecting moms and empowering moms. Yeah. Go spread the word.
We will.
Thank you.
Thank you so much.
Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitiveMidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.